all you need to know about body acne, the products that are great for it, the skincare ingredients you definitely should have, and the bad habits that you're doing that is leading to your body acne. If you're new here, welcome, and please click the subscribe button so you don't miss out on my daily shorts and weekly YouTube videos. I have adult acne, and when I get stressed, my acne tends to pop up on my chest and back predominantly. I still get breakouts on my face, but my chest and back mostly. And this is my picture during one particular breakout. This is residency. I was super stressed, and from studying, taking care of patients, being in clinic, and all the other responsibilities that I had, and I started breaking out. And as you can see in the picture, it's not only the little, acne bumps, it's also the dark spots that are on my chest that tend to happen after my acne breakouts. I feel personally that when it comes to body acne, one of the most irritating things are the dark spots that are left long after the acne lesions have faded. But the good thing is the ingredients that you use to treat body acne can be used to brighten and fade those dark spots. So I'm going to be talking all about those in this video today. First things first, what causes acne? Because the main things that cause acne on the face also lead to acne breakouts on the body. Acne is usually caused by excess sebum production and dead skin cells leading to clogged pores, with subsequent bacterial colonization causing inflammation, and then we have, boom, our breakouts. Now the breakouts on the body, just like the face, can present in the form of whiteheads, blackheads, pustules, and cysts. Acne on the body can range from mild to severe. So additional factors that can contribute to your body acne include genetics. Acne-prone skin may run in your family, and there's not much you can do when it comes to changing your genetics, but there's some things you can do in your lifestyle and skincare to better control flare-ups of acne. Then we have hormones. So hormonal imbalances, especially those related to menstrual cycles, can cause oil glands to overproduce sebum, leading to more breakouts. That's why in puberty, our skin just lights up. The hormones that were not present before are now, fluctuating and influencing our oil glands to produce more oil, and the excess oil leads to clogged pores, boom, and then breakouts. And then we have medications. Many people don't know this, but the medication that you might be taking can actually cause body breakouts or breakouts in general. So medications like antidepressants are particularly notable for this. And then we have stress. So yes, heightened stress levels can lead to hormonal fluctuations. When you're stressed, your body releases a hormone called cortisol. Cortisol can stimulate your oil glands to produce excess oil, leading to clogged pores. That is what happens in my case. That is my trigger, stress. Every time that I get really stressed, I tend to break out on my chest and back. So stress is a big factor that can contribute to body acne and should not be ignored. And then we have wearing tight clothing. Now wearing tight clothing leads to a condition called, or a type of acne called acne mechanica, in which we have sweat and oil combining along with the friction from the clothing, subsequently leading to body breakouts. Another factor is sweating or excessive sweating. Acne-causing bacteria thrives in moist environments. So if you are that person that sweats a lot, especially under tight clothing, that can be a recipe for breakouts. Last but not the least, hairstyles. Yes, your hair grooming products, whether it's your shampoos or hair conditioner, or even hair oils that that run down your face when you sweat, can also lead to acne breakouts. When it comes to treatment for acne in general, we usually use combination therapy of topical medications like creams and lotions, as well as sprays, and oral medications like antibiotics and even Accutane. So what can you do to treat body acne? There's several things that you can do in your lifestyle as well as your skincare that can be very impactful when it comes to body acne. Derm pro tip 1, take daily showers. Acne-causing bacteria loves moist environments like I mentioned. So if you are sweating or you sweat during physical activity or as you do during workout, it is very important that you shower immediately after workout. I totally understand You may not want to shower at the gym, but that extra 20 or 35 minutes or however long enough it takes for you to get home can let acne-causing bacteria start working its magic, especially if you're wearing tight workout clothing. As I already mentioned, it can lead to acne mechanica. If you don't have time to shower at the gym, at least change out of your sweaty clothing while there and then wipe down with a non-rinse-off cleanser like micellar water post-workout. So just put some micellar water in your gym bag and have that with you to at least get that sweat and dirt off your skin before heading home. Derm Pro tip 2. Exfoliate during shower. Now, dead skin, sweat, and excess oil, as we've established earlier, can lead to clogged pores and breakouts on the back. So the ingredients that I always advise patients to look for when it comes to acne in general are ingredients like salicylic acid. I love salicylic acid because it's lipid soluble. It's going to penetrate your oil-clogged pores to dissolve excess oil and dirt. I also like other chemical exfoliants like glycolic and lactic acid in body cleansers or sprays. And then there's benzoyl peroxide that has anti-acne bacterial properties and also helps unclog pores. So salicylic acid, benzoyl peroxide, glycolic acid, lactic acid are all wonderful ingredients to look for when you have body acne. Some of my favorite body cleansers for body acne include Necessairs. One of my top most favorite. It has salicylic acid, glycolic acid, and lactic acid. It also has physical exfoliants in it. So it's a combination of chemical and physical exfoliation. And then I love the 2% salicylic acid body clear by Neutrogena. It's very accessible and also affordable. You can find it in your local drugstores. And then there's Panoxyl. It's a benzoyl peroxide based cleanser. It's a Panoxyl Maximum Acne Foaming wash with 10% benzoyl peroxide. Now, if that's too dry, you can find another product that has a lesser concentration of the benzoyl peroxide. But these are all wonderful products in terms of cleansers to take care of body acne. Another good body exfoliant is this one by Bliss. Now, this is a Clear Genius body spray, acne body spray. I like this spray because it's great for hard to reach areas like the back, and it's lightweight. You just spray it on and let it dry, and you can step outside the house. So it's a very convenient exfoliative body spray to use. You would just shower regularly and then apply this, and then we follow with a moisturizer on top. So you can layer it with other skincare products if you wanted to. And this is actually alcohol free, so it's not going to be too drying on skin. So I love this particular product with 2% salicylic acid for body breakouts during the summer. So Derm Pro tip 3 is to replace shower accessories like your loafers. Just keep some loafers in stock and replace them with fresh ones every 3 weeks. And if you use a washcloth, just make sure you're using a clean one each time you shower. And never share your washcloth with other people. Derm Pro tip 4, avoid picking. This is a very important one. I can't stress this one enough. Don't pick or squeeze your pimples and blackheads on your chest, back, shoulders, and even on your face. Here's what happens when you pick your pimples or on the skin, on the chest and back. It causes more inflammation, and it puts you at risk for post-inflammatory hyperpigmentation or dark spots, as well as scarring. It may be tempting to just go at your acne with your fingers, but that's what your chemical exfoliants are for. So trust me, your skin will look much more better in the long run if you resist picking or scraping away at your acne. Derm Pro tip 5, wash your dirty towels. Because really, there's no point cleansing skin only to use a dirty towel. You're just transferring bacteria to your back all over again, or your chest. So damp towels breed bacteria. Make sure you hang your towels to dry after using them and wash them at least a minimum of once a week. Derm Pro tip 6, moisturize with anti-acne moisturizers. Now, acne-prone skin needs moisture too, and even better with anti-acne ingredients, which can be very drying to skin. So keeping your skin adequately hydrated and moisturized can regulate sebum production. After showering, make sure to hydrate your chest and back with lightweight, non-comedogenic body lotions with anti-acne ingredients like lactic acid, glycolic acid, salicylic acid, and even benzoyl peroxide if you do not mind bleaching your clothing. With benzoyl peroxide, because it has a bleaching effect, always wear old clothing or have beddings that you don't mind getting damaged. Now, after you shower, you should moisturize with body lotions like the SLMD Glycolic Acid Body Lotion, Lactin Daily Moisturizing Body Lotion, and Paula's Choice Weightless Body Treatment with 2% beta-hydroxy acid. I also like the alpha hydroxy acid Smart Renewal Body Serum from Ren. You can also apply your targeted acne treatments like prescription retinoids on your chest or prescription azelaic acid. Now, if you don't have access to prescription azelaic acid or topical retinoids, you can use ones over the counter. And one that I really like is this one by Paula's Choice. This is a 10% azelaic acid booster. It comes in this little tube. Now, if you have to use it on your chest, you have to buy multiple of them. So you just open it after showering and get a little bit and rub it on your chest and back. And you can do that as well for your over-the-counter topical retinoids. For over-the-counter topical retinoids, I would advise the Different because it's the strongest non-prescription topical retinoid available directly to you over the counter in your drugstores. So those are kind of treatments you can apply on your chest and back to target your acne after getting out of the shower. In conclusion, please see a dermatologist if your body acne is not getting better despite your best efforts. These tips are not meant to replace your dermatologist. Sometimes body acne can be confused with a condition called folliculitis. Folliculitis simply means an infection of the hair follicle. Now, folliculitis, like acne, can present on the face, arms, chest, back, butt, and legs. Because this can look similar to acne, it is important to see a dermatologist if over-the-counter products are not working. While mild folliculitis and acne can be treated with over-the-counter antibacterial products, sometimes prescription topical and oral medication may be needed for severe or treatment-resistant folliculitis and acne. Remember, skin on your back is thicker and sometimes topical treatments may not be as effective as oral treatments like oral antibiotics or even Accutanes. Oral treatments are sometimes what make the difference in this condition. Definitely see a dermatologist and to talk about your options. That's it on this episode on Brownskinderm, living for body acne. Please leave your questions and comments below, and don't forget to subscribe if you haven't for daily shorts and weekly videos, and I'll see you next time. Bye.